kids are in crisis. Worsening mental health prompted the American Academy of Pediatrics to declare a national emergency.
Many Utah families understand the crisis all too well and the long and frustrating wait to connect with a therapist. That wait anywhere from 2 to 6 months here in Utah.
So how do we help our child during that gap? Tonight, Ashley Moser shares steps we can take today. Ashley?
Well, Mike and Deanie, as a parent, hearing it may be months before your sick child can see a therapist is scary. But that's exactly what many families are hearing. But mental health professionals here in the state say there are also available resources immediately, and they want families to take advantage of them.
Valentina, she's a warrior. She's amazing. She's like the dream child.
Monica Lopez says there are countless ways to describe her 12-year-old daughter, Valentina. A bold personality, and in typical preteen fashion.
She makes us all follow her rules.
But life hasn't always been easy for the family.
So we had some heartbreaks in our lives, and so especially with her dad leaving the home at an early age.
It took a toll on Valentina's mental health, and at just 8 years old, she got professional help.
I was angry a lot of that time. I had a lot of anger issues. So I guess after like 2 months of therapy, I got like a lot more happy, I would say.
It was a short stint of therapy, one Monica felt worked. Her daughter began to blossom, smiling and laughing again, enjoying life. But that all changed 2 years later when the pandemic hit.
Pandemic, it kind of shut down that side of her, you know. She couldn't go out, she couldn't hang out with her friends as much.
Monica started noticing the same signs of depression.
You know, she expresses herself very well. And at one point, she stopped expressing herself.
Is it easy to talk about some of the things that you've gone through?
No.
Tell me, why do you think that?
It's just because like the way that everything happened so fast, just like not a lot of people have like, I guess, gone through what I have. And it's just hard when they ask like, are you okay? And I'm like, I'm not, but I can't explain why I'm not.
And when her mother asked the difficult question, are you suicidal?
I was just shocked. I was like, how did she know?
The family didn't waste time finding a therapist.
I called them right away, make an appointment.
But that appointment
It took like 3 months.
was months away. A frustrating time for Monica as she watched her daughter sink deeper.
Like she said, she was feeling hopeless, and I was feeling hopeless too.
In general, we used to talk about waits being weeks. Now we talk about it being months.
Jessica Holtzbauer, a licensed clinical social worker with the Huntsman Mental Health Institute, says what Monica and her daughter experienced is standard right now.
People have not been able to get in to see an outpatient provider because they are slammed. They don't have openings. And so there's a trickle-down effect where then kids who need a higher level of care are sicker than we've ever seen them before.
A year into the pandemic, the Institute found that 40% of Utahns saw an increase in anxiety and depression, with 8 out of 10 children reporting those very symptoms. Those who got hit the hardest?
Kids who struggled already with depression and whose go-to was to isolate or withdraw, that just exacerbated the issue.
Although the wait time may seem discouraging to parents, Holtzbauer says don't overlook other resources. The most underutilized one, you can use your primary care physician to connect with a therapist.
There are fantastic short-term therapists who are in community clinics who can see the adolescents or kids who are struggling.
She also encourages parents to reach out to their child's school counselor. But if it's an emergency.
And then we also have a same-day clinic where they can meet with a physician that day.
Another option, Holtzbauer points to the Safe UT app.
Not many adolescents want to pick up the phone and make a call.
Where kids and teens can chat with a mental health counselor via text, no wait required. In 2021, nearly 31,000 total chats and tips were received through the app, and 298 life-saving interventions were initiated. Immediate help in the palm of a child's hand.
I am very hopeful that it's going to get shorter.
Holtzbauer says the Institute is expanding resources with hiring and infrastructure. This is what the Institute's Crisis Care Center will look like when it opens in 2024. The $47 million facility will have a wing dedicated to adolescents' mental health. A center children like Valentina would benefit from. Today, she sees her therapist weekly. Her mother says she's already noticed an improvement. And although the family had to wait for that care, they're glad they got Valentina the life-saving treatment when they did.
I'm not gonna let her cry herself to sleep every night. I want her to be happy. I want her to know that she can be successful and she can be great in everything she does.
No, I won.
Now, Valentina has been in therapy for about a month and a half, and her family tells me when they got that call for the first appointment, they felt like they won the lottery. Now, if you or someone you know is struggling with a mental health crisis, there is help available 24 hours a day, 7 days a week. Also, you can use the Safe UT app, or if you're facing an immediate crisis, call the Utah Crisis Line at 1-800-273-8255. So